One thing that's not talked about enough, at least in my opinion, is the impact of GLP-1 agonists on joint inflammation. We hear about all the other ailments and comorbidities that these medications are treating or in clinical trials for, but we don't hear specifically about the impact on joint inflammation. Hello, my name is Charles, and I go by the round man of Zepbound. Welcome to my channel. Now, there are studies going on, but I also think that I am a testament to the efficacy of these medications on joints. Of course, any weight loss will help lessen the impact and stress on the joints, but studies are indicating that there is an anti-inflammatory mechanism in these medications, which is independent of weight loss, and they work by reducing disease activity and providing joint protection, which reduces joint damage and erosion. Now, if you know my history, you know that I played high school football and college football, and I put my body through a lot, and I mean a lot of damage over the years. I was a literal crash test dummy. I was having the equivalent of an auto accident 60 to 80 times a game, and that doesn't even cover the damage that I put my body through going through practices year-round outside of the games. So as a result of football, I have had 3 hip surgeries, which includes a full hip replacement, and at some point I'm going to have to get the other side replaced. I've had my right SI joint fused. I've had a back surgery, a laminectomy. I also have no disc space between L5 and S1. It's just bone on bone, and I can feel my bones grinding against each other as I move around, which is a funny feeling. I have facet joint syndrome, which is caused by arthritis throughout my spine. I've had a bilateral hernia repair. I've had a tibia-fibula fracture on my left leg, just broke clean through, and then I also had the tibia cracked at the top near the knee. I have no cartilage on my kneecaps. I've had shoulder issues, including frozen shoulder, which I had for over a year before seeking help from a doctor. I couldn't move my arm above 90 degrees, and about the time that I started taking these medications, I went to the doctor and I did some physical therapy, and I couldn't get it to move. So I was scheduled for a procedure in February of 2024. Now I started taking the medication in January of 2024. I think I was on my 6th week of the medication. I think I was on my 2nd shot of 5, and they told me that I would have to stop taking the medication for 2 weeks due to the risk of aspirating during the procedure due to the slow digestive mechanism that these GLP-1 medications cause. So I was kind of worried about that. But suddenly my shoulder started moving again, and you can see now that I can move my arm freely. I got full range of motion. So is that a coincidence? I don't think so. I think it was the medication working on the inflammation in my joints and reducing that inflammation and allowing me to move my arm freely. So as a result of that, I was able to cancel the procedure. I still have a little pain here and there, but I haven't had any issue moving it since February of last year. Now, because of all these injuries that I left football with, I also had 3 surgeries related to bariatric procedures as I attempted to get my weight off so I can move more freely. And I had a lap band. The lap band failed, and I had to get it removed. So that's 2 of the procedures. And then a year after having that removed, I transitioned to a gastric sleeve, and that helped for a bit, but then the weight came back on, I want to say 4 or 5 years later when COVID hit. So the surgery, at least the gastric sleeve surgery, did allow me to move more freely, but I had always had this cycle where I would move and I would be doing good for a while, and then inevitably something else would flare up in my body that I would have to seek physical therapy for, rest my body in order to stop that inflammation and that pain. Then I would be on the couch on the sideline, not being able to get to the gym and work out or go for a walk. And that will cause me to lose motivation. That all changed when I started taking Zepbound. In 2024, I worked out the entire year. I logged 495 activities across 258 days. I totaled over 295 hours of workouts compared to just 100 hours of workouts in 2023. So I almost tripled my workout time. I burned over 160,100 active calories while working out compared to just 48,100 in 2023. My walking distance went up from 220 miles in 2023 to 762 miles in 2024. So this cycle was in effect The medication would help reduce the inflammation in my joint, allow me to work out more consistently in order to drop pounds, along with what the medication was doing in that regard. And as I lost weight, the stress on my joints got less. And as the stress on my joints got less, I was also able to work out more. So, of course, they are looking at these medications as a way to treat rheumatoid arthritis and osteoarthritis. I think, at least anecdotally for me, I think this is a good indication that these medications do just that. So there's so many indications that these medications are being looked in for. The GLP-1 medications and interacting with the GLP-1 receptors in the body, and to reduce inflammatory properties in your body, to protect your cardiovascular health, to be protective of your organs in your body, to reduce your blood pressure, to treat sleep apnea, and a whole other host of things. So people are using it to treat PCOS and a whole other host of things. So these medications are absolute game changers, and I cannot wait to see what comes next as these medications advance and more studies are done. So don't forget to like, subscribe, and ring that bell so you'll get notifications next time that I post a video. Until next time, I hope you all have a great day.